This teaching resource is aimed at first-year students before they start placement. A first year's guide on how to fly through hand X-rays. When you get a request card for a hand X-ray, you must remember there is always two standard projections, dorsipalmar and dorsipalmar oblique. Once you have introduced yourself to the patient as a student radiographer, assuming that the room is clean and prepared for the patient, make sure that you wash your hands before contact with the patient to reduce the risk of cross-infection. The patient will then be seated with the affected arm nearest to the X-ray table. For computed radiography, the cassettes are composed of three sizes: 35 x 43, 24 x 30, and 18 x 24. You need to select the size that is appropriate. Once the patient is seated and the right cassette size is selected, the cassette is then placed under the affected hand. The hand should be pronated face down onto the cassette. The fingers should be relaxed and slightly separated to avoid superimposition of soft tissue. Positioning the hand for the DP oblique. Again, the cassette is placed under the hand and in the middle. However, this time you externally rotate the hand by 45 degrees. This means to put the hand onto its side and let the other fingers drop onto the cassette. The hand should look slightly clawed. Once the hand is positioned, we then think about centering points. For a DP hand, we center the X-ray beam, also known as the vertical central ray, over the head of the third metacarpal. For the DP oblique hand, we center the vertical central ray over the fifth metacarpal. We then angle the tube 3 to 4 degrees over the head of the third metacarpal. This is to ensure the central ray is central on the image. The focus receptor distance, also known as the distance from the cassette to the X-ray tube, should be 115 cm unless stated otherwise. Exposures for hand X-rays. kV value determines contrast in the image. MAS value determines image blackening. Average exposure for a hand X-ray is 60 kV and 2 MAS. However, you may need to adjust exposures depending on patient size, for example, pediatric. On both projections of the hand X-ray, you must ensure you include all the anatomy of the image criteria, from the distal phalangeal tufts up to distal third of radius and ulna. Don't forget to include your markers. This is what standard hand X-rays, DP and oblique should look like. Some tips as to what students do wrong. On the DP hand X-ray, students tend to not leave enough space between fingers, which results in superimposition of soft tissue. Secondly, not flattening the hand out straight enough. Thirdly, to clip off essential anatomy within area of interest. For the oblique hand X-ray, students tend to center in the wrong place, or the hands are either curled up too much or not enough. And lastly, students tend to collimate too much or too tight, again missing off areas of anatomy. Overall, this PowerPoint has demonstrated key points in how to carry out a successful hand X-ray, from centering points to positioning the patient and the tube, exposures and projections. I hope this helps.
Created using Powtoon.